Good evening, everyone. My name is Simran Chaudhary, and I welcome you all on behalf of Voice of Healthcare on this important panel discussion on blood cancer awareness, lighted red for blood cancer, organized by Voice of Healthcare and supported by Pfizer. We are gathered to shed light on a topic that affects countless lives but often goes unnoticed: blood cancer. With September being Blood Cancer Awareness Month, this is a timely opportunity to raise awareness, share insights, and discuss advancements in prevention, diagnosis, and treatment for this life threatening disease. Today's session will not only inform us about the complexities of blood cancer, but also highlight the critical importance of early detection, the role of public awareness, and the advancements in personalized medicine that offer hope for better tomorrow. This conversation is crucial in our collective effort to educate, prevent, and treat blood cancer. And today, for this panel discussion, we are privileged to have with us an esteemed panel of medical experts who are at the forefront of the fight against blood cancer. They will guide us through various aspects of blood cancers like leukemia, lymphoma, and myeloma, and from understanding early symptoms to exploring the latest innovations in treatment. Our discussion will cover general awareness, diagnosis, treatment option, patient support system, and future research. Now, I would like to welcome all my esteemed panel speakers for this panel discussion. Dr. Akanksha Garg. She is consultant Hemato-Oncology and bone marrow transplant at Zydus Hospital, Ahmedabad. Welcome to our show, ma'am.
Hi.
Hello. Dr. Aditya Jandial. He's an assistant professor, medical oncologist at Tata Memorial Center, Homi Bhabha Cancer Hospital and Research Center, Mullanpur, New Chandigarh, Punjab. Welcome, Dr. Aditya.
Hello, hi, good evening, everyone.
Good evening. Dr. Riaz Ahmed. He's Senior Director, Hematologist, Oncologist, and Bone Marrow Transplant, Max Super Specialty Hospital, Saket, New Delhi. Welcome to our show, sir. And Dr. Kartthik. He is a little occupied in some emergency, but I believe that he'll join us in mid of this. So, moving forward with our conversation, with the esteemed panel discussion, I would like to start with the general awareness in education. My first question is to Dr. Riaz Ahmed. So we would like to understand about blood cancer. So could you explain what actually is blood cancer and its different types that people should be aware of in layman's language, so that every person out there who's listening to this can understand about this?
Sure. Hi, Simran. Thank you. Thank you for calling us on this show. So, first, before understanding this blood cancer, we should understand cancer. So, cancer is abnormal growth of any living cell in our body, which grows undivided, means uncontrolled growth, basically. So, basically, God has made in such a way that every cell divides into two, and one dies, one lives. Again, it divides into two, again one dies, one lives. Basic understanding. Okay, when these cells divide two and they don't die as early, both survives. Again, two will become four, four will become 10, 10 will become 100, and 100 will become 1,000. That is cancer. If it happens in skin, it is called skin cancer. If it happens in liver, it is called liver cancer. If it happens in blood, it is called blood cancer. Now, blood is not a single, like a liquid. It is like a lot of cells in there. So three main components: RBC, WBC, platelets. So mainly the cells uncontrolled growth of any of these cells will cause cancer of its own specific type. So this is general about blood cancer. Mainly we see three types of cancer. One is leukemia. Again, it can be acute or chronic. Acute can be AML or ALL. Chronic can be CML or CLL. The second type is lymphomas, that can be non-Hodgkin's lymphoma and Hodgkin's lymphoma, that mostly in the lymph nodes that are part of blood system. And third is multiple myeloma. So this is basically a group of plasma cell disorder in which the plasma cells within the bone marrow increase exponentially and producing its abnormal cancerous protein which causes this. So three groups mainly in the blood cancer: leukemia, lymphoma, and myelomas. And as I said, cancers, uh, um, understand the concept of cancer and it applies to the blood. That is blood cancer. I think so. That should be clear.
Thank you so much, sir, for explaining that to us. Moving on, my next question, Dr. Aditya. Can you tell us about what are the most common early signs and symptoms of blood cancer like leukemia, lymphoma, and myeloma that people should watch out of for? And once they, they get to know that okay, this is happening, so and that is the correct time to rush to the doctors.
Good evening, everyone. Thank you for the organizers and the team of Voice of Healthcare. So, as Dr. Riaz beautifully, emphasized that the blood is not just a single tissue or just a single component. It is composed of different cells. We all know that there are red blood cells, white blood cells, platelets, which are the main components of blood which is circulating, and the source of production of all these blood components is the bone marrow. So we call the bone marrow as the factory from which the blood is produced. So in the setting of leukemias, particularly acute leukemias, the normal production of these components is hampered. So what the symptoms that we usually see are the byproduct of lack of these normal components in the body. So lack of normal levels of RBCs leads to anemia, and that leads to common presentation in the form of fatigue, generalized weakness, breathlessness on exertion. The reduction in the WBCs or the lack of like adequate numbers actually leads to recurrent infections. So somebody who is developing recurrent fever, sore throats, is like something that can be attributed to the reduction of white cells, and a reduction in platelet count is something that leads to increased bleeding tendency. So that is commonly in the form of gum bleed, nose bleeds, red spots on the body, or ecchymosis, which is like in the form of blue spots, and easy tendency to bleed from even after minor trauma. So that's something that we commonly seen in the setting of leukemias. When we talk about lymphomas, so the name suggests that lymphoma is a cancer of lymph nodes. So the enlargement of lymph nodes is something that is very commonly seen in these patients. And apart from that, we often see patients having unexplained fever lasting for several weeks, unintentional weight loss, night sweats, and last, since you asked about multiple myeloma, so that is a kind of blood cancer that affects the skeletal system. So we often see patients presenting with bony pains, back pain. Some patients present with fractures sustained as a result of minor trauma, and because ultimately all these malignancies, these involve uncontrolled proliferation of cells, and as Dr. Riaz said, that they occupy the space which is there in the bone marrow, and that hampers the normal the blood components. So anemia, and ultimately renal dysfunction, and sometimes as I mentioned, because the normal immunity is impaired, so recurrent infections is something that we commonly see.
Thank you so much, Dr. Aditya, for shedding light on the signs and symptoms of different types of blood cancer. Now, my next question is to Dr. Akanksha. Dr. Akanksha, are there specific risk factors or population that are more prone to this blood cancer, and how can individual assess their own risk? As you know, if a person knows, okay, I'll be the most, I'm on the target list, or some, if I'm my lifestyle is something like this, so I should be aware of this. Is there any kind of a thing to get to know, okay, I should be aware of this?
So yeah, hi Simran. So definitely, I mean, there are certain risk groups, like you said, certain populations which may be more prone to developing blood cancers. So we have certain factors which are probably permanent. Like if there is a family history, of a patient who has a history of cancer in the family, then in these particular populations, then there could be a possibility of having blood cancers. So this is not just true for blood cancers; it can also be there for other cancers as well. So definitely, family history is important. Then there are certain genetic conditions also, like patients. Like in the pediatric age group, we have patients of Down syndrome. So those patients can be prone to developing acute leukemias. So that is, these are some of the non-modifiable risk factors. Then in addition to that, even patients who are aged, the elderly age group, so they are more prone to developing cancers, because the repair mechanisms of the body, like Dr. Rayaz mentioned. So the repair mechanisms of the body become faltered. So that's why they are prone to developing different kind of cancer. So that is definitely one of the factors. And the type of cancers in each age group is also different. So in the children, there will be a different type of blood cancer. The spectrum will be different. In the adults and the elderly age group, it will be different. Then after that, even with the gender, sometimes like we talked about multiple myeloma, so it tends to be more common in men. So we would see a spectrum of patients with myeloma. Would be majority of the patients would be males. So that is there. In addition to that, if certain occupation hazards are also there. So we have certain patients who develop cancers because they have been working in chemical industry, or petroleum industry. So all that can also be positive for cancers. And if a patient has certain infections, especially viral infections, if they have had a previous history of hepatitis, so that can also trigger cancer later on, not in the immediate phase, but definitely later on. And many times there are some patients who have immunodeficiency disorders. So and especially patients who are retropositive, having HIV infection. So sometimes they also tend to develop cancer. So these are some of the risk factors which are there. And having said that, assessing the patient or the individual's risk for developing cancer. So of course you cannot predict who's going to develop the blood cancer, but if there is a family history, yes, you may be interested in consulting your hematologist or the healthcare provider, and even visit maybe a genetic counselor, so they may help you identify whether you are at risk of developing a certain cancer. So that is there. And in addition, regular blood investigations, especially after a certain age, getting your CBCs done, and that can help in identifying if there is any abnormality in the blood counts. Because many a times some of the leukemias, the chronic leukemias, they may just be incidentally picked up on the blood reports showing very high white cell count. So definitely, I think regular checkups and being aware of like what the symptoms have been elucidated by Dr. Aditya very nicely. So if you're having a prolonged fever, and there are some lymph nodes that you're able to feel, so then definitely that is the time that you should not ignore it, and maybe consult your physician to get evaluated.
Thank you, Dr. Akanksha, for mentioning all those possible risk factors that people are like some group or population is more prone to getting blood cancer. But as you mentioned about the early detection, some tests and all, I have a follow up question on that. So, how crucial is early detection and prognosis of blood cancer? And what are the most effective methods for early diagnosis? As you were mentioning, few of them. So, I would like if you can elaborate on that.
So main would be that the like regular. That's how we are basically showing the importance of getting regular checkups and your blood investigations timely. After a certain age, maybe after, because most of the blood cancers, if you see, they are more common in the adult age group and the middle-aged elderly age group. So if you get a regular blood test, then sometimes for a leukemia, it would be just a low blood count or a moderately low count which would be there. Then similarly, if you have a low platelet count, so every time it may not be just a simple thrombocytopenia or immune thrombocytopenia. It could need further evaluation, because as we age, there are various disorders that may present with that particular manifestation. So that is extremely important. For blood cancers, it is not like you have screening for prostate cancer, or for ovarian cancers. All that is definitely, it is not always possible for blood cancers. But being aware of your symptoms and getting regular blood investigations done, then you may be able to find out whether it could be a possible sign of blood cancer. But as such, getting a screening test specifically for blood cancers, we usually don't have any such markers. But having said that, I think just an annual blood investigation reports and everything, that would definitely help in the long term.
Thank you so much for explaining that to our audience so that they are well aware of what are the best, detection methods or screenings available that can help them to be, at cautious and aware of their health. Moving on to my next question to Dr. Riaz. Dr. Riaz, what are the common challenges faced in diagnosing blood cancer, especially in its early stage, and how can these be overcome? Like you have great experience in this, you're seeing patients, treating them since a very long time, and I believe you would have come out with some of the methods that normally is workable on field. So you're on mute, your mic is mute.
I'm sorry. I'm sorry. So, see, as we discussed earlier, three types, different variants of blood cancer: leukemia, lymphoma, myeloma. Now, leukemia mainly is the typical blood cancer, in which the cancer cells, which we call blast, which are increased. Because this is increased, the hemoglobin is low and the platelets are normal cells are decreased, as Dr. Aditya was explaining. Now, anybody can develop this acute leukemia in a span of a week, 2 weeks, or a month. Now, how they will present? They will present as fever or some bleeding gums or some red blood spots on the skin, some weight loss, fatigue, some things. And it happens a week, 2 weeks, month, the maximum. So, if I develop a fever, I am not going to suspect acute leukemia that I have developed acute leukemia. First, all patients will do, okay, weakness, I'm tired, I will take some rest. When there is some bleeding, okay, maybe my brush is not. They will try all the local measures, some blood spots. So they go locally, get the blood checked. Sometimes it's not being picked up by the lab, sometimes it is picked up by the lab. So, but if you have the symptoms again and again, make sure this the lab you ask the treating physician. This is means I'm getting these problems again and again, and repeat. Sometimes repetition of blood tests, simple blood tests, CBC, will pick up the leukemias. So blast cells. So CBC is the first test in leukemia to be checked with peripheral smear. A lab doctor must see if the blast cells are there or not, especially if the patient is having low hemoglobin and platelets. Very simple, very easily widespread available, very cheap. That will help you to say, okay, this patient is suspected to have a blood cancer or acute leukemia. Then he can be referred to higher centers to get the bone marrow test, or even from the blood, we can do the flow cytometry test to diagnose specific type of leukemias. Okay, this is about leukemias. I'm just telling CBC. That's it. Okay, especially when you are having fever, fatigue, and on symptoms you are finding low hemoglobin, low platelets, and WBC is increased or low, either ways. So smear should be checked and CBC. Now coming to lymphomas. Lymphomas is, as Dr. Aditya was saying, it's a swelling of lymph nodes. So all lymph node swelling, the lymph nodes are present in everyone. When it gets swelled up because of this, um, any reaction, okay, infection can cause lymph node swelling. We all have in the neck area or armpits or groin area, this swells up. So not all lymph node swelling are cancers. So most common is tuberculosis. Even the symptoms of tuberculosis and lymphomas are same. So in India, TB is more common than lymphomas, but sometimes a clinician may say, okay, this is TB. He may start anti-tubercular, but not responding. He will go for biopsy. So in lymph node swelling, if you are having some B symptoms like night sweats, weight loss, okay, um, weight loss over more than 10% body weight, okay, this we say in conjunction with the lymph node swelling, you get a biopsy done. When it is showing lymphoma, uh, you can be referred to. So lymph node swelling with, when you do a biopsy, and if that biopsy shows us a lymphoma, should be referred to any higher center for accurate. Treating all lymph node swelling as tuberculosis sometimes delays the diagnosis of lymphoma. But mind it, I'm not saying all lymph node swellings are lymphoma. It can be tuberculosis. It can be anything else. Most the differentials of lymphoma come later down. Benign conditions are more common. Benign means which are not cancerous. Third is the multiple myeloma, that is more of a clinical diagnosis. So in myeloma, what happens? This you have symptoms of backache or any joint pains, or not exactly bony pains, low hemoglobin, and so patients generally go to three different people before reaching an oncologist. First, it will be when the hemoglobin is low, as Dr. Aditya was saying, he may feel fatigue, lethargic, and on evaluation of anemia, when we do a bone marrow, we find increased plasma cells, and then we are able to diagnose that okay, it is multiple myeloma. If it is having chronic backache, no patient will go that okay, I am having myeloma. He will change his posture, take painkillers. Later down the line, when he reaches the orthopedician, you do an MRI or X-ray, then you are able to pick up some spots in the bone. You do a bone marrow, then he is being referred from orthopedician because of compression fracture or any. Third is that when they have renal failure, when the kidneys creatinine goes up, the symptoms of nausea, vomiting is there. People go to the nephrologist. Why my creatinine has gone on? Then on evaluation, they find to have okay, this is multiple myeloma, and being referred to oncologist or hematologist. So these are all things. So CBC for the leukemias, lymph node biopsy for lymphomas, and CBC, KFT, LFT, that is kidney function test, liver function test for multiple myeloma. This simple test, which is we do, can you can suspect the diagnosis of blood cancers. Dr. Akanksha was also saying about the uh, uh, different ways, early the annual health checkups. So we are able to pick up nowadays a little bit early because some cancers are chronic. The people go for annual health checkup, especially middle age, elderly, and we are now seeing little bit early the chronic leukemias being picked up early before they become symptomatic. That's a good part. So we should not feel bad that doctor is asking to do sometimes some regular check, and doctor is asking to pay for so many. These are very few simple things. God forbid somebody develops, but if it develops to someone, it can be picked up early. It does make a lot of difference in the treatment. When you start treatment uh, early in the process, your outcomes are better. Thank you.
Thank you so much for emphasizing on those tests and how it is, it helps us to identify and everything. And you said it right that those tests, early detection tests, are most important so that a person or a patient can be saved from this deadly or, a very dangerous disease. So thank you on that. Moving on to my next question, Dr. Aditya Jandial. How important is the role of of support system, including family counseling and patient communities in journey of blood cancer patients?
So I would say that I would, like to emphasize that uh, so the treatment of blood cancers is actually a marathon, okay, for many malignancies. And I would say that support of family members and support groups is something that is indispensable, and it is very important to, maintain morale of the patient, keep the patient in high spirits. uh, I would say that there is lot of heterogeneity as far as like treatment of blood cancers is concerned between low middle income countries like India versus high income countries like Europe and United States. So I would say that since right from the word go, once the patients start developing symptoms, they need initial evaluation, require multiple visits to the clinic for various tests, their interpretation, counseling, visiting the daycare for receiving chemotherapy. Some patients do require radiation as part of their treatment as well, and obviously maintaining a good, maintaining good overall hygiene and providing good nutrition. Everything counts. Okay, everything has its own purpose, and all these things are important for achieving good overall outcomes. So here I would say the support of family members is something that is indispensable. And we have seen that patients who have good socioeconomics, good family support, they do well, definitely. I would say that, and I would say that as far as support groups are concerned, so I have seen that since my uh, training days, and in last couple of years, since I have been working as a consultant, sometimes there are lot of questions and lot of information that patients, um, they try to seek information from their peers. Okay, and I would say they are more comfortable in discussing a lot of things with uh, other patients and family members. And sometimes there are like they are not that comfortable in front of doctors to begin with. Gradually, I would say that they develop good rapport, and the flow of information is something that is very productive for the patients. But definitely, I think the support systems, the support groups, the survivor groups, patients who have overcome the disease, those who have fought the disease, they can share their experiences, and that's helpful. I think there are few charitable trusts who are doing very good work in this domain, especially in the space of myeloma. And I do encourage my patients to be part of those groups, and wherever possible, if I can contribute to their overall knowledge, and I most often do that.
Thank you so much, Dr. Aditya, for emphasizing on the patient support group, and why I asked that first in case of treatment, because the person, when it gets to know that he is suffering from blood cancer, or the families, because the news gets announced and the family and everyone gets little disturbed about this, because I can feel that. I have seen that in my family. My grandmother was diagnosed with pancreatic cancer. When the news break out in our family, we all were very disturbed. So this was one of the first reaction ki how patient support group can help in overcoming that. But now, like you also mentioned about some treatment options. So I would like to know from you that what are the primary treatment options available for blood cancer patients today?
So, in general, I would say that whenever we talk about treatment options for cancer in general, so conventionally we all say that it is chemotherapy, radiotherapy, and surgery. So these are the like three pillars of treatment. But we all agree that in the past couple of decades there has been like advent of targeted therapy or immunotherapy, and there has been lot of advancement in the supportive care. So I would like to emphasize a little bit on each one of them. So as far as chemotherapy is concerned, so since early 60s, I would say there have been discovery of multiple chemotherapy drugs. And we use different combination of drugs as far as blood cancers are concerned. And the purpose of using these drugs in combination is to prevent development of any sort of drug resistance to begin with. And we give these drugs at specific time intervals. Let's say some of the regimens or chemotherapy regimens, they are given every 3 weeks, and that is based on the rationale that uh, in in between the 3 weeks the normal tissues are going to regenerate, but the cancer cells are not going to do that. Okay, that is one thing. I generally give a very crude example to my patients when I discuss these chemotherapy drugs. So these are like, if I quote the example of cricket, so if I am the bowling team, so I am using different bowlers in combination and different spells, so that the best batsman doesn't get used to scoring runs, and we want to curtail the runs. And it is just like the game of cricket. We have different phases of the game: the power play, the middle overs, the death overs. Okay, and we have different drugs or combinations for different phases of the game. And the purpose is to initially contain the disease, and then consolidate the control that we have achieved. And in some malignancies like multiple myeloma we discussed, we give one or two drugs as maintenance for long term period, so that the disease doesn't come back early. Okay. Coming to the radiation, we all know that some malignancies are exquisitely sensitive to radiation, and that's why if we have to salvage the organ failure in some patients, we resort to radiation, especially like we talked about lymphoma presenting with lymph nodal enlargement. Sometimes, like as emphasized, early diagnosis is important, but unfortunately, we sometimes see patients presenting at a very later stage with very large lymph nodal masses in the neck, sometimes in the chest, which are leading to respiratory difficulty and lot of kind of medical emergency. So sometimes we do resort to radiation therapy at the outset to salvage the organ function. Sometimes, obviously, radiation is also used as a measure to relieve pain, especially in the setting of multiple myeloma, where I mentioned earlier that bone involvement or bony pains is something that can be very debilitating and refractory to the treatment. Uh, Third, I mentioned surgery. So in blood cancers, I think it has a limited role, as mentioned by Dr. Riaz, that lymph node biopsy is something that we always prefer for the diagnosis of lymphoma. And in multiple myeloma, as I mentioned, fractures are something that can be the presenting manifestation. So fixation of fractures to maintain or restore the integrity of the skeletal system is something that we always desire to have, because if a patient is ambulatory, he's he's expected to do well as compared to someone who is bedbound. Okay, so maintaining the ambulatory status is something that is quite beneficial to the patient. Talking about the targeted therapy or immunotherapy, so our understanding about the blood cancers has significantly improved. So there are a lot of studies where we have come to the understanding that there are specific targets on the cancer cells which can be targeted with the help of special immunotherapy drugs, and they can be beneficial, and they may have effect on the cancer only, and lesser side effects are going to be there. So they are there in the form of monoclonal antibodies, and we have drugs like tyrosine kinase inhibitors, which have completely changed the treatment of blood cancers in last couple of decades. Last but not the least, I would say the supportive care is very important. So by um, supportive care, I mean that now in the treatment of many blood cancers, giving prophylaxis to prevent infections. Sometimes, in some cases, we do prefer giving vaccines, and obviously taking good care of patients, or prompt care of patients. I would say that is a more ideal word. If somebody develops infections, we are very proactive in giving antibiotics. If somebody develops low counts, we give growth factors so that they can recover early, and they are less vulnerable to infection. So I think all these measures, all these things, they have their own role as far as overall landscape of treatment of blood cancers is concerned.
Thank you so much, Dr. Aditya. As you explained that in a very beautiful way, very elaboratively to all our listeners out there about the treatment options available for blood cancer. But moving on to Dr. Akanksha, I would like to know, can you discuss some of the latest advancements in blood cancer treatment, such as targeted therapies, immunotherapy, and bone marrow transplants? And how does that differ, or the treatment options differ from various types of cancers?
Yeah. So yes, definitely a very pertinent question, I would say. So it has been basically discussed briefly about the immunotherapy and targeted therapy by Dr. Aditya. But main advantage of these advanced treatments is that, like he said, that the side effects are minimal. So what we mean by targeted therapy is that it would act mainly on the cancer cells, and the normal cells would be basically they will not be affected. So the side effects are less. Then many of these targeted treatments are oral therapies. So basically in the form of tablets and capsules. So the patient, it is very convenient for the patient to take, and they need not come again and again to the hospital for getting these treatments. So they can take the therapy for 1 month, and follow up 1 or 2 monthly, and basically according to the type of cancer that they have. Second is the immunotherapy. So, in that, the main purpose is that the immunotherapy is designed in such a way that it helps the body's own immune system to act against that particular cancer. So, that is a very effective manner in which the immunotherapy works, and it has a very beautiful science behind it. And the good thing is that these two treatments now they are available in India, and many of these treatments are also affordable. Recently, you would have heard about the the CAR T cell therapy, which has been, and India has made its own CAR T, which is now being used increasingly for the blood cancers, especially the leukemias and the lymphomas. So all these treatments are definitely something we can look forward to, and they are changing the landscape of the treatment as well as the outcomes of these diseases in the patients. And with time, I think for the last 5 to 6 years, all these treatments have, the Indian companies have started making these treatments also. So they are increasingly affordable now for the patients. And I think in the future, they hold a lot of promise. And if we talk about the bone marrow transplant, so which is basically the hematopoietic stem cell transplant, basically means that you are replacing the diseased marrow of the patient from where the cancer is originating with the healthy stem cell. So it is of basically main are two types, which is autologous and allogenic. So in the autologous, mainly the donor is the patient itself, and in the allogenic, it is a healthy donor which gives the stem cell. So these treatments have been there for quite a long time, and even in India, it has the first transplant was performed in the 80s. So for the past almost 30, 40 years, many centers are doing the transplant. Now, if we talk about the autologous transplants, there are mainly very few indications for autologous transplants in blood cancers. So we use it for the myeloma as well as the lymphomas, so the Hodgkin's and non-Hodgkin lymphomas. So for that, we are using the autologous transplant, and the allogenic transplants are used for the leukemias, majority for the leukemias, but there are other indications also for the lymphomas where we can use this. And the types of allogenic transplants can be, if you have a basically there is an HLA typing which is different from the simple blood grouping. So it is a specialized test which helps you know whether your marrow will match with that of the patient. So if there, the most common donors are mainly the brothers and sisters of the patient. And now with advances, we also are able to do transplants or the half match transplants from the parents, or any the sibling. If it is not a full match transplant, then a half match transplant can be done. And another important thing is that now we say that sometimes we may not get a donor, suitable donor. So we have certain registries also. Like you have voluntary blood donors. Similarly, there are voluntary marrow donors also. And India itself has quite a number of registries now which are there, and they are definitely something to look forward to, and they give a wide variety of options for these patients to take treatment. And I think, I mean, at the end, I would just like to say that with all these therapies, the outcomes of blood cancers have been as good as 80-85%. What it used to be 2 to 3 decades earlier has definitely, it has improved quite a lot. And I would say that as compared to the Western countries, in India also we have good trained hematologists and hemato-oncologists, and we are able to provide the best of care and treatment options to our patients.
Thank you, Dr. Akanksha, for shedding light on that advances in treatment for blood cancer. But moving on to my next question to Dr. Riaz, can you explain me how is personalized medicine, like we were talking about, Dr. Akanksha was explaining us on that. So how is personalized medicine changing the landscape of blood cancer? And do you have any example of how treatment are being tailored to individual patients and how it is helping them?
Sure. Quite specific question. I was not expecting in this forum. So personalized question, medicine I can say. So see, first understand how the medicines are being made, how the regimen is being made. So any cancer, the work has been done in last 30, 40 years, and ultimately what we have today, the group of medicine which is working on a disease over a period of some trials has been done over the last 30, 40 years, and we have some medicines available now. That is in the trial form, now applicable into the general public. But still, the patient of India, okay, or the persons living in India, although human beings are different from the person living in US, are different for the persons living in Africa, on the patients or the persons living in China. So
Yes.
everyone is human, but they have different genetic makeup. Diff- so each person is different. So same disease affecting everyone, and if we tend to use the same drug in the same strength which has been used in the trial, that is little bit too much to expect from. So every area will have the group of these patients will have different PKBD. What we say, their absorption and the drug distribution differs. Again, every person genetic makeup is different. The same way the genetic makeup of a tumor, not the person tumor, can vary. So they can have some tumor suppressor gene, not very tumor active, some markers which can be present in the one set of patient, which can become the target. So I say 2 points. The same common regimen, the PKPD different. So you have to see which how much drugs is being. So first local trials, the local the how many in the Indian perspective, how much the patients have been the given regimen has been used, how much strength has been used. This should come up, and the other is if let's say example of leukemia, and we have get the genetic mutations just done and try to find out any specific targets which is available uh, to these patients. So that against this target, if we have any drug that can be added, which will make little bit the treatment tailor made or personalized, so that he can have a better outcome. So this is all meant by personal, but still 90% of our protocol we stick to what the guideline says, which has been formulated in the Western world. Fortunately, unfortunately, I can say they have been formulated in the Western world, where the patients are mainly Europeans and the Americans. We are just trying to get it from there and trying to apply in this. So the need is to get those trials redo in our country. We have to get our own data, and whatever patients we have done, collect this data all over in the get reported in a registry, so that will have a feel okay how it was used, and we can have some of our local guidelines. The second point I was making, that the mutations, if we can do the next generation sequencing, the mutations can tell us, and against these mutation, if we have some drug working, that can be added. This is the way the regimen can be tailor made, and you can expect success. So say leukemia patient, the stage has to go for chemotherapy, transplant, for bone marrow transplant, all these are told to the patient in advance.
Thank you, Dr. Riaz, for sharing your insights on personalized medicine with us, and
I think
you explained this very well that these kinds of things are available in most of the other countries, and we need our own guidelines and own examples to set the rules and regulations for this. Moving on to my next question to Dr. Aditya Jandial. We talked about the basic primary treatments available, then we talked about the targeted therapies, and then moved on to personalized medicine. But after all the treatments, I would like to know what are the common side effects of blood cancer treatments and how patients can manage them effectively with the treatments they are taking. Dr. Aditya, can you hear
Yeah,
me?
yeah, yeah. So I think Dr. Akanksha and Dr. Reyes have like beautifully described that the treatment, the goal of the treatment is to achieve initial disease control. Okay, whether we are using chemotherapy drugs in combination alone or with radiation. So I think because the most of the chemotherapy drugs, they have a non-specific mechanism of action, so they affect the tumor cells as well as the normal body organs as well. So the most common side effects that we commonly come across in clinic, they are generally in the form of fatigue, generalized weakness, loss of appetite. Some patients do complain body aches, And there are certain specific side effects of drugs that we often use in clinics, like uh, some of the chemotherapy drugs are prone to cause anemia, thrombocytopenia as a result of their very specific, their mechanism of action. So as a result of that, fatigue and sometimes bleeding manifestations, they can be seen. We always emphasize on the fact that therapy is going to have some impact on immune system. So uh, 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 you know uh, the decrease in immunity during the course of treatment is something that can make a patient prone to develop infections. So preventing infections by taking up hygienic measures, whether hand hygiene, and to avoid any such practices where the patient can be prone to infections in public spaces and all. So we often educate our patients for these things. And apart from that, there are certain specific side effects, like we have drugs like bortezomib, which is used for multiple myeloma treatment, that can lead to tingling, numbness in hands and feet. We have some drugs which can lead to rash or skin manifestations, pigmentation. Um, I think the most common side effect that the patients are worried about is the hair fall, hair loss, which is like seen in around, I would say, majority of the patients who are receiving the conventional chemotherapy drugs. And as Dr. Akanksha said earlier, with the use of targeted therapies, these side effects are lesser. I would not say they are completely gone, but they are lesser as compared to the like conventional chemotherapy drugs. So I think broadly these are the side effects. And if we are using certain targeted medications, then we do pay attention to you know taking measures to circumvent severe decrease in the white cell count during the treatment. So we give growth factors during chemotherapy, so that the patient doesn't develop very low counts. And wherever required, we either give transfusions or give erythropoietin, which is a drug to improve the hemoglobin level, so that the hemoglobin levels are maintained more than 8, so that the quality of life of the patient is preserved.
Thank you so much for explaining on the preventive measures. My next question is to Dr. Akanksha. Like Dr. Aditya, bit of explain us about this measures of lifestyle that can reduce the risk of developing blood cancer. I would like to know the same from you. There any preventive measures or lifestyle changes that can reduce the risk of developing blood cancer? Along with what role do public awareness campaign play in fight of blood cancer against blood cancer, and how can it be more effective in educating general population?
So yeah, definitely. I mean, I think it's always good to have a healthy lifestyle. So just eating good eating habits, eating a lot of vegetables and fruits which have good antioxidant content. That is very important. In addition, I think um, basically mental health is also important, as well as maintaining a healthy lifestyle, in the sense doing exercise or moderate exercise. That is also important to avoid any excess obesity. Then in addition, I feel that although there is no direct connection of blood cancers with the alcohol intake and tobacco, but I think in uh, the we should basically restrict that as well, and tobacco intake and alcohol intake should be curtailed as much as possible. And also, in for blood cancers, it is not always true that if you follow all these golden rules and follow all these good lifestyle practices, you may not develop it. So it is not always predictable that any person who is following all these measures may also develop a blood cancer. So what you need to know is that developing a blood cancer, it doesn't mean that it is not curable. It is not a death sentence. So definitely, even if you have it, then you should have the willpower that you can overcome it. And I think that is more important, because I've had patients who would come, and once we break the news that yes, the patient has blood cancer, so they always ask that we have all the healthy lifestyle practices, we don't take alcohol, tobacco. So like I said, there are various other factors also that can lead to cancers, like environmental pollution, exposure to chemicals, things like that, or if they have acquired some kind of viral infection which may have occurred earlier in life, that also could lead to blood cancers. And then we also have the genetic factors which can induce. So preventive factors are there, but you can never predict who can develop a blood cancer. So I guess, but in general, follow the healthy lifestyle practices, and I think that is important.
Thank you, Dr. Akanksha, for that. My next question is to Dr. Riaz. Dr. Riaz, we know that there are some ongoing research going on. So I want to know what are some of the most promising research areas in the fight against blood cancer, and how close are we finding a cure to it? We cannot we cannot see you, Dr. Riaz. Can you hear us? Hear us? I think there's some internet issue. He cannot hear us or something. So, Dr. Aditya, can you answer this to us about the ongoing research?
So I think we have already covered some of these aspects in the questions that were addressed earlier. So I think right from early diagnosis, the role of screening in certain malignancies, uh, like the use of targeted therapy. Overall, I would say the improvement in treatment is going in parallel with improvement in our understanding about the blood cancers. Okay, so since our understanding has improved, earlier we had very simple tools for diagnosis. Now we have more sophisticated methods where we can not only diagnose blood cancers at an early stage, but as far as the monitoring of the response to treatment is concerned, so we have very sophisticated tools where we can detect one cancerous cells in, I would say, 50 million normal cells. So it was, I would say, it was unimaginable 10 or 20 years ago. But now most of the centers are resorting to these technologies for improving the overall outcomes. um, Discussion about immunotherapy, targeted drugs has already been covered, and CAR T cell therapy, the latest addition in the armamentarium against the blood cancers, has been highlighted by Dr. Akanksha. I would say uh, improvement in the overall tolerability of the drugs, and I would say the improvement in the supportive care. So these are the things which are making a lot of difference in the outcomes. Earlier, where we had a lot of incidents of infections, life threatening infections, where the supportive care mechanisms were not that developed. So right now the systems are more sensitized as far as management of these side effects are concerned. I would say in um, in low middle income countries like India, fight against infection as far as the treatment of blood cancer is concerned goes hand in hand with the regular treatment, I would say. So that is something that makes a lot of difference.
And Dr. Akansha, we know that some of the clinical trials are going on. So, can you explain the role of clinical trials in the blood cancer research, and what should patients know about this who are participating in these trials?
So yes, like Dr. Rayaz also mentioned about the trials. So there are a number of drugs now which are available. Like in the Western countries, they are there, but now to get data of these particular drugs in Indian population, because we are different from the Western side. So a lot of clinical trials are available, and especially in the big institutions which have a very high number of patients. So these trials are being conducted. So what happens is that what the patient should know is that definitely, I mean, you can ask your doctor when you have a particular disease. You can ask the doctor that are there any clinical trials where you feel that I would be able to get a certain drug which is probably going to because through the clinical trial the patient is going to get it for free, and that option is definitely there. And in the clinical trial the patient should, however, what I would like to highlight here is that sometimes these trials are blinded. By blinding we mean that whether the patient is going to get that drug or the comparator arm, which is the placebo, what we call as the placebo, that is not revealed either to the doctor or to the patient. So getting onto the clinical trial, definitely if it's a 1:1 sort of ratio in the trial, then 50% chance is there that he may get that drug and may benefit from it. So one thing that is, and every time when a trial is done, a very detailed consent and counseling of the patient and the patient family is done, so everything is explained. But definitely many of the centers are conducting trials, and even for rare diseases like for the blood cancers as well as the non-blood cancers, they are there. So of course you can get information from the doctor. So that definitely that option is now available in India as well. And many a times patients who are affording, they can also travel to other countries overseas to US and get access to the best drugs which are available for the blood cancer.
Thank you so much for explaining that to us. And I would just like to ask you to give us a closing remark for this panel discussion and advice for newly diagnosed patients and someone who has just been diagnosed with blood cancer. What advice would you like to give them?
Yeah. So definitely, I think once a patient is diagnosed with blood cancer, it is initially it is very overwhelming for the patient as well as the family. But as compared to other cancers, the solid cancers, lung cancers, blood cancers have a very good outcomes. But the main thing is that when they present, they are the patient has very is quite sick, and the patient has a lot of complications related to it. So that's where the role of the supportive care and giving the chemotherapy on time or immunotherapy on time is very important. So what I tend to stress is that even if it's a very aggressive treatment, the aggressive disease, with timely treatment and the proper management, you can have good cure rates. Like I said, approximately some of the diseases can have 80-90% cure rates also. So one positive thing about blood cancer is this. Then second, I would say is that once you are diagnosed, then a lot of patients tend to do a lot of doctor shopping. So I explained to them before starting treatment that you should decide, fix your doctor, listen to one
Yes.
particular doctor, don't go to different doctors for opinions, because that is not going to help in the management. So that is very important. They should have trust and faith in the particular treating doctor that they are taking treatment under. So second thing is that then I feel that again, like very nicely highlighted by Dr. Aditya. So patient support, the family plays the very important role. And then we have certain support groups also, like in India we have a myeloma support group, and various other groups are there. And some of the NGOs also for financial support, they are there. So patients have options for that. And blood cancer, once the patient is diagnosed with it, then you need to keep a positive mindset and have the willpower that you can overcome the disease, and you would definitely get treated and have a good outcome. And I think quality of life of the patient is important, like we talked about the targeted therapy. So I think these agents are helping improving the quality of life. So I think now more and more patients are not shying away from treatment for blood cancer. So it is not, like it is not a death sentence, I would say. So patients have access to a lot of good options now and with lesser side effects. And precision medicine, like highlighted by Dr. Rayaz, that is now gaining a lot of importance. So according to the particular mutation, you can give that particular targeted therapy that is important. And one last thing I think I would like to highlight is that every type of blood cancer is different. So when they talk to their peers or some other patients, then what we need to explain to them is that probably their leukemia or their lymphoma is a different kind of disease which requires a different treatment. So they should not be just thinking that they were given this treatment and things like that. So, and with even if it's the same disease that a patient is having, then different patients with the same disease can have different outcomes, and the basically the effect of chemotherapy can be different in two patients who have the same disease. So all these things have to be told, and proper counseling of the patients timely, because these patients stay with us for a quite long time. So they have to be explained, and multiple counseling sessions have to be done, and that, I think, that helps in proper treatment compliance also, and patients are not lost to follow. So I think that would be my message to a person who's diagnosed with blood cancer.
Thank you, Dr. Akanksha, for giving us your closing remarks and sharing your insights with us. Dr. Aditya, I would like to know your final thoughts and the one message to the public you want to leave with regarding the blood cancer awareness and importance of early detection and treatment.
So I would be like, I would like to highlight two aspects. So I think the foremost important thing is to destigmatize the blood cancers. Okay, it is very important. We have um, um, uh, very dreaded depiction of blood cancers in our movies, lymphosarcoma of intestine, right from Dr. Amitabh Bachchan's movie to we have like uh, a perception in the society that once the blood cancer is diagnosed, the person is gone. Actually,
Yeah.
it is not true. Okay, I would like to give an example of CML. So we talked about the patient support groups, the family support. If you talk about like someone getting diagnosed with diabetes mellitus at the age of 25 years, he or she is going to require medications for rest of their life. So that's certain. I would like to give an example about CML. That requires just one medication, and that has to be taken for a protected time. But we have come across situations where newly diagnosed patients, they are abandoned by their families just because of the fact that they have been diagnosed with blood cancer, which is actually going to have very good outcome and near normal lifespan. This is what the literature says. So I think it is very important to create awareness about the blood cancer and destigmatize this disease. That's number one. Second thing is about the early diagnosis. So I would like to emphasize that blood cancers are curable if detected early. Okay, that is something that message should be straightforward. We see patients coming at later stages with lot of disease burden, lot of alternative medications, lot of infections, and at that time it is very difficult to salvage these patients from such life threatening situations. So I think early diagnosis is something that can significantly improve the outcomes, and rather than fearing from the healthcare systems, I think the healthcare attention should be sought early, as far as the symptoms are concerned. So these are the two points.
Thank you so much, Dr. Aditya, for sharing your insights with us, and thanks a lot to Dr. Akanksha and Dr. Riaz, who I guess got disconnected because of some internet issue. But thanks a lot to all of you for coming to this platform, sharing your time, expertise, and insights with us, because it matters a lot. We really want to spread as much as awareness we can spread for blood cancer. Should public should know about what exactly it is, what are the early signs and symptoms and treatment options available. And like you said, cancer is not a death sentence. We have some scope. We have a lot of treatment options available. We can work on it together, and we can live our life again after cutting this from our life. So thank you so much for coming to this, and thanks a lot for all your expertise.
Thank you.
Thank you.
Thank you.
Thank you so much.